I'm Carmen Elliott, Vice President of Payment and Practice Management with the American Physical Therapy Association. And today we have with us Harold Miller, CEO for Center for Healthcare Quality and Reform. So Harold, my first question for you is, realizing that you've done a lot of work and studies on healthcare payment and delivery reforms, can you tell us what is the major problem with the current fee-for-service model out there now?
Well, I think there's actually two problems, Carmen. One is that it's called a fee-for-service system, but in many cases there is not a fee for every service that providers could offer that would actually be of high value to their patients. For example, in many cases having a telephone conversation with a patient to help them understand discharge instructions or what their care plan would be can be very helpful, but there's no compensation for that. There's no compensation for providers to talk to each other to be able to coordinate care. There's no compensation to be able to bring a patient in for a physical therapy session that they may need if they don't have access to somebody to drive them. The other problem is that if you deliver fewer services to a patient, even though it would achieve a good outcome for the patient, you get paid less because the payment isn't really based on outcomes, it's based on how many services you deliver. So when we talk about how to change the payment system, what we're really trying to do is overcome those barriers, the barriers that say that you ought to have the flexibility to be able to be paid for what actually works well for the patient, and that better outcomes shouldn't cause providers to become financially unviable.
Right. So my next question, Harold, will be, and along those lines, knowing so much emphasis has been placed on physicians and hospitals and rarely on physical therapists or other non-physician groups, tell us how can we be in the driver's seat for these alternative payment models? Is there any advice or strategies that you could give us to put us in a driver's seat?
Well, one of the problems with the payment system is it has really focused heavily on more payment for expensive procedures, and there has been an expectation in the past that somehow those expensive procedures and tests are better for patients. People have come to recognize now that it's actually better not to have to go to the hospital, and it's better not to have to spend time in an institution if you can avoid it. And I think one of the real areas of value that physical therapists bring is to be able to help patients potentially avoid surgery, to be able to get them back home more quickly, but there's no reward for that today. So I think a physical therapist can start to make it clear what they can accomplish if they can receive the kind of payment that they need. I think that they will be seen as high-value providers by both physicians and by payers, and potentially become much more important players in the healthcare system than they have been seen so far.
Great. That actually leads me to my next question. So realizing that we are moving from fee-for-service to a value-based model environment, tell me how physical therapists and maybe other non-physicians can collect data and show their value to other providers and to the overall healthcare system.
Well, I think, first of all, there are a variety of studies that have been done that already show that value. I think one of the most important things to do is for physical therapy practices to step forward and say that they want to try to do something different and find willing payers. In many cases, it may actually be employers that are interested in trying to do something differently. And physical therapy practices should start to talk to the employers in their community about what kind of value they can provide to be able to get employees back to work faster, to be able to improve their productivity, and to try to do some pilot projects like that where they can actually demonstrate what can be done. It's very difficult to do things simply under research grants. You really want to be able to show that if you were being paid differently, you could do something differently. And then that also helps to give confidence to other practices in the field to say, well, if they can do it, then potentially we can do it too, because that process actually worked. And I think the other advantage of trying to work with employers is not only just to demonstrate the data, but I think that employers are much more willing to be flexible about trying to make something work if they see this as a valuable supplier that can work with them on an ongoing basis, so that in the early stages of this, when it's not really exactly clear how to do it, having that kind of partnership with an employer to say, we're not quite sure how to make this work, but we want to do something that will be a win-win for both of us. I think that that's a potential way to be able to move forward.
Great. Thank you so much, Harold. We really appreciate your presentation on today, and we'll talk to you soon.
Thank you. It was a pleasure to be here.